So let's evaluate some of the strengths and some of the weaknesses of using single subject designs. We have limited external validity. So again, this is pretty common sense. If you're only studying one person, one subject, you really can't generalize far beyond that subject and say that that intervention would work with anybody else. But you do have pretty good internal validity. Because of those repeated measurements, you're able to rule out a lot of those threats that we've talked about before. So it's pretty safe to say your intervention worked on the person or on the subject you're researching. So why then would researchers use single subject design if it limits you to just talk about that one person and you can't generalize beyond? Well, sometimes these big studies for interventions are pretty intensive or pretty difficult, and if you can do an effective study showing that it works on one person, you might be able to convince somebody to give you money to test if it works on other people. So remember, the general rule in science is that if you can replicate it, you get more scientific basis. And so if you can test it on one person and then test it on another person and then test it on more groups of people, and you keep seeing the same results, that is good science. That's what you want to see. And of course, you may not be interested at all in doing research for the sake of research, but you probably want to evaluate an agency or a program, and you're going to want to use it in those types of settings as well. So let's look then more specifically at how this ends up being used in social work practice. So in social work practice, we do a lot of case notes or progress notes when it comes to working with clients. And oftentimes we seem to write things like, client seems to have improved, client appears to have a better relationship. And it's obviously very, very subjective. So even if we have no interest in testing whether our intervention works, maybe we just want to test whether the client is making progress. And maybe we want to do so objectively rather than just basing it on what we feel or how it seems. Even if we know what we're doing works, it's really hard to explain that to supervisors, to other people, to family members. So it helps us explain, it helps us monitor progress during the intervention itself. Now that comes with its own issues, of course. Because we talk about repeated measurements, then that can be frustrating for some clients. Maybe you've got so many clients, you don't have the time to sit down and collect, for example, a survey 2 or 3 times before you begin. And realistically, a lot of social workers, we work in crisis. If you work at a psychiatric emergency center, meeting with people that have recently had a suicide attempt, you're obviously not going to say, let me withhold treatment while I observe the number of times you say you want to kill yourself, and then we'll do an intervention. You can't ethically do that. You can't practically do that either. So we do have some issues. So we have to think very carefully about what we do and how we do it. So, for example, maybe we're not asking the clients. Maybe we're doing something indirectly. Maybe we're going and asking teachers or family members to give us the information, and that keeps us from putting the burden on the client or even on ourselves. So then we have to stop and think, what then am I measuring? If I'm measuring client progress, maybe I'm doing it indirectly. I still have to figure out what I'm measuring and how I'm measuring it. So we still have to operationalize. We still have to define our variables. We have to operationalize them, and we have to choose something that occurs frequently and can be measured regularly. But we can't choose something that requires so much measurement that it becomes burdensome. At the same time, we're going to measure something. We have to know when something begins and when it ends. It doesn't help us to measure stuff that's infrequent. And of course, what we measure must show clear pictures of improvement. So let's look at some examples. Let's say that we're doing substance abuse outpatient treatment. I want to measure the number of times a behavior occurs. This is one type of indicator. So I might ask somebody to report the number of alcoholic beverages they've had. Now I have to think, is this a good indicator? Do I ask the client, or am I asking family members to report this? Maybe I'm training supervisors to be more effective, or training social workers to be more effective supervisors. And maybe part of that has to do with longer supervision times. So I may have them track the length of the supervisory meeting. It has to be something that happens regularly. If this only happens once every 6 months, probably not a good measure. And I obviously have to understand those meetings, and how to capture those. What's a supervisory meeting versus just a friendly hello? If I'm treating dementia patients, and these are patients that get hospitalized every couple of weeks, maybe the goal is just to delay the amount of time that they get hospitalized. So maybe it's a success that they get hospitalized once every 2 months versus once every 2 weeks. And in that case, I don't have to wait for them to get hospitalized. If we go 3 weeks, 4 weeks, I've already achieved success, for example, if my goal was to increase the amount of time until a hospitalization. So again, I have to understand what defines a hospitalization versus an outpatient treatment versus an emergency or an urgent care visit. And then, of course, I can measure magnitude. So maybe I have a standardized scale. Maybe I ask a client to rate something on a scale of 1 to 10, and I'm measuring the intensity of something. And maybe my goal here is to decrease the intensity. So you see there are multiple ways that we can measure behavior or psychological states in social work. We just have to find the thing that makes sense based on the criterias on the 2 previous slides. So stop and think about how you might measure some of these, or what indicators you might use other than what I've specified here.